RSV Academy. Questions about RSV. In few words, what is RSV for adults?
RSV, respiratory syncytial virus, is commonly thought of as primarily a pediatric disease. It was discovered in 1956 and rapidly identified as the cause of bronchiolitis in children. But nearly at the same time, it was clear that it could affect adults, young adults. But it was largely ignored until the 1980s when there began to be some very serious outbreaks in long-term care facilities or nursing homes. And this was back in the days when we really weren't using PCR, and the methods of identification of RSV were really suboptimal. But it was clear that certain populations could get quite sick. It just wasn't clear what was happening in the 95% of people, older people that don't live in nursing homes, as to how common it was and whether it was a real problem. So there was some statistical modeling studies that were done that linked event rates that were mostly in children when they were doing viral cultures to cardiorespiratory deaths. And what surprised people was it was estimated there were 335 RSV-related deaths in the United States annually due to children, but there were 11,000 in adults over the age of 65 and nearly 2,000 in middle-aged adults. So this in no way diminishes the death of a young child, but it certainly highlighted that there was something going on in older adults. So about 20 years ago, we began a 4-year study that was very comprehensive, prospectively following groups of outpatients, older adults, and then people admitted to the hospital. And what we found, using a combination of a sensitive PCR and acute and convalescent serology, that RSV infected about 5.5% of the study population each year, compared to influenza A, which was 2.1, and influenza B. Now, I always point out that this is a highly influenza vaccinated population, but it was clear that there was a lot of infection going on. So I mentioned that that was 20 years ago, and we were very happy to see a study that came out of Europe by Koers Korsten, where they basically replicated our study. Between 2017 and 2019, they found that the rate of infection of RSV was 5.7 compared to 5.5. Influenza was 3.0 and influenza B was 2.7. So it was in between. There's been many studies using different kind of methodology that have looked at RSV in adults, and it really is a significant health problem. It causes about 15 per thousand of medically attended diseases. People go into the clinics, and hospitalization rates really vary with age with adults. So if you look at the age-specific hospitalization rate in population-based studies, it's about 8 to 12 per 100,000 if you're between the ages of 18 and 49. It rises to 34 to 58 per 100,000 for people 50 to 64, and really goes up very significantly over age 65, 135 to 256 per 100,000. So age is clearly a risk factor. So, if you're just going to estimate how much disease does RSV cause in adults, just looking at the U.S., it's about 1.7 million outpatient visits, roughly 100 to 180,000 hospitalizations, and somewhere between 8 and 14,000 deaths. So certainly a disease. So why was this not recognized for so long? And it's important to point out in adults that pretty much all infection is reinfection, so they have less virus in their nose. They also have underlying medical conditions which may overshadow how they present. So what does RSV in an adult look like? Well, it can range from a mild cold to really respiratory failure and death. Common symptoms are nasal congestion, cough, sputum production, and shortness of breath. Unlike flu, fever is not a prominent part of the illness. It can have a very significant impact on an older person's ability to do their activities of daily living. The average length of illness is about 17 or 18 days. And 42% of the people who became infected in our study were housebound for a day. They just didn't feel well enough to go out. And 6% were bedbound, and then 38% could not do their activities of daily living. And so, you know, not a minor cold in everybody for sure. It's important to point out that there's no specific antiviral treatment. There is no oseltamivir as we use for influenza. So a certain number of these folks, they end up getting hospitalized. And the most common diagnosis is pneumonia, but there's also exacerbations of chronic medical conditions such as heart failure and COPD and emphysema, and therefore the viral trigger is sometimes not recognized. And a certain percentage of RSV can be complicated by bacterial infections. It's not an easy thing to study, so we don't know that, but antibiotics are frequently prescribed because the doctor hasn't tested for RSV and, you know, thinks, well, it could be a bacterial infection. And so I'll just sum it up by saying, you know, that RSV in adults is a significant problem. It is a cause of hospitalization, death, and then just really unpleasant illnesses, even if you don't end up in the hospital, that can be quite prolonged, leading to some functional impairment. And for the present time, we don't have any treatment, but we have to have good hand hygiene and strategic masking for our older, frail adults. And now we do have some licensed vaccines, so hopefully things will change.